Good afternoon, everyone. I'm Hartford Healthcare's Tina Verona. We are coming to you live from the Hartford Hospital Women's Ambulatory Center, where there's a special event coming up this Saturday, and I'm joined by two special women to tell us all about it, Evelyn Lopez and Nora Bergaris. Evelyn, I want to start with you. First of all, ladies, thank you for joining me today. I appreciate it.
You're welcome. Welcome.
So, Evelyn Lopez, you are the women's administrator here at the clinic. Tell us first about the services that are offered here at the clinic.
Okay. We service obstetrics, high-risk pregnancy, midwifery, menopause.
And this is for women in the community. This is serving women who would otherwise not probably have access to this care. This is reaching out directly to those women in the community.
Yes, this program in partnership with CDC program, we help the patients with no insurances. So this is going to be over 8 years helping them. I serve as a volunteer, and then we do. Oh my God, sorry, I forgot.
No, that's okay. And listen, a volunteer is so vital. Your role, Evelyn, is so important because you are volunteering your time to help women in the community. Tell me a little bit about your role and what you do.
Yes, we met, this is a planning for almost a year. So we meet with the coordinators, and we get volunteers from here for the clinic. And because all the patients, most of all the patients, I can say like 99% of the patients are Spanish-speaking patients. So we help here with translation with the provider. And then we just go through, it's like as soon as they come in, they register, they do the vital sign with the patient, and then we bring it to the room with the provider. We support the provider with interpretation. We clean the rooms, and everything's good.
Such an important role that you play, Evelyn, so I don't want to lose sight of that. Without you, you're a very integral part of this program. Nora Bergaris, I want to bring you in, and you're part of the grant process for this. Let's talk about the grant. Since 1995, you've helped tens of thousands of women who otherwise probably would not get the care that they need. Tell us about those numbers.
That's correct, and I can't tell you how excited I am to be on Facebook Live to get the promotion that it's very much needed. Early on in my position, as I started here at Hartford Hospital, I realized that I didn't know I'm educated, I'm resourceful, and I'm a Hartford resident. I lived in Hartford pretty much all my life, and I wasn't aware of the wonderful services, screening services at no cost to uninsured or even insured individuals that may have a high deductible, and they're free at no cost. They're not free because we're funded by the Center for Disease Control and the Department of Public Health. And we're able to screen. So one of the ideas that I had, it was a Women Wellness Day. How can we take our services out of the hospital setting and go out and reach and recruit these women who are vitally in need of the program resources? One of the objectives of the early detection program is that patient engagement. It's really getting that relationship, that trusting relationship with the patients that for many reasons may not want to come to a clinical setting and get screenings, life-saving screenings that will save their lives because they may not be diagnosed at an early stage of their life.
And I think you said it so eloquently. It's, you're educated and you know about this. You live and breathe it every day. These are women who don't and who don't have that access. So bringing the access to the community is incredibly important. Tell us about the Wellness Day and all that goes into it and what women get out of it.
Okay, so just a few background history of how it started. Again, I had this idea initially when I first started with the grant. I had the funds, but I didn't have the volunteers. As Evelyn talked about volunteering, we need, it's a group effort. It's a collaboration with many different people, providers, doctors. So there was Dr. Brennan, who had the idea of PAP Day. She wanted to bring a PAP Day with, she's with Physicians Women's, and she's also here at Women's Health. So she wanted to provide PAP Day out in the community for free PAPs. She had the providers, she didn't have the doctor. We were both connected, and Women Wellness Day was born. And our first Women Wellness Day was in collaboration with Malta. House of Care, yes. And then we collaborated over in Wyndham Hospital. Then we came to Women's Health, and we loved it so much here that it was just been an amazing collaboration. Early on, we actually screened here. Our first number of patients was over 35 patients that we screened. Wow. This Saturday, we're actually aiming for 48. We have 4 providers ready and willing. We have a host of volunteers, including MAs, registers. We have the mobile bus for the mammography. So what we do is we screen for the early detection of breast and cervical cancer, and a component of our program is cardiovascular disease. So we're also offering free blood screens, which checks your cholesterol, your triglycerides, and your glucose.
Now tell us where it's going to be offered, the time, and all the details if folks out there want to come and stop by.
Okay, it's here at Women's Health and Military Health Services, 474 Hudson Street in Hartford. It's at the time, it's 9 a.m. till 1 p.m., 9 a.m. to 1 p.m. You are encouraged to pre-register. We have an extensive paperwork, but you're not limited to registration. You are more than welcome to walk in, and if those slots are filled, we can go ahead and book you for future dates with our regular scheduled clinics. So we just want to make sure that the residents of the greater Hartford area are aware of our services, and just start talking about the screening program that we have as a resource to them.
And women interested in coming for these services for Women's Wellness Day, is there anything they need to do to prepare before they come?
Other than your regular, just don't wear deodorant, make sure you come, just prepare comfortable clothes, nothing else. And if you're getting blood work, you can't eat. You can't eat after 12 o'clock.
Right. And what about the results? When do women find out about the results?
The blood work results are fairly quickly, right there and then. We do provide also a risk reduction. We also, the mammogram results are given maybe about by Monday. They might have it. If not, by Wednesday, they should have some sort of a call from us or radiologist.
And Nora, I want to talk about the follow-up care because that also is very critical too. Now, let's say a woman comes to the event on Saturday and there might be something suspicious found on a mammogram and she may be called back for a biopsy. You're there through that process. Take us beyond what happens after the event on Saturday.
Absolutely. So the early detection program is a team effort. It's a clinical navigator. It's myself, the health system navigator. It's a community health worker and the program director. So my job as a health system navigator is to recruit the patients into the grant in collaboration with a community health worker, make sure that they're navigated throughout the system that understands and educate our patients, empower them so that they know the importance of screenings. And in addition to that, work with my clinical navigator to make sure that these patients are not fall through the cracks, that they understand what their results mean, what the importance of follow-up. Even though we're a screening program, we are able to offer biopsies, ultrasounds, excisions, surgical consults, and when there's a positive diagnosis, we're also able to, if the patient has a legal status in the U.S., we're able to fast-track them into Medicaid, which gives them a full coverage of treatment.
And I think that's so important too to stress is that not only is this just a screening program, but you go beyond that, and it's not just the event itself, that you're with these women every step of the way and providing that support, which is so incredibly vital. It takes a village to run something like this, and without you two and all the others that donate their time like you do and work for this cause, you're helping so many women, thousands of women 35,000 women to be exact since the grant started. So thank you, ladies, both Evelyn Lopez and Nora Bergaris, for joining me. We really appreciate it. And thank you, as always, for joining us. There's an event coming up this Saturday, Women's Wellness. We'll put all the information on the screen for you in case you're interested. Hartford Healthcare's Tina Verona. Thanks so much for joining. We'll see you soon.